This video will highlight the importance of the functional components and its subdivisions with the application to all the 12 cranial nerves: olfactory, optic, oculomotor, trochlear, trigeminal, abducent, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and hypoglossal. So what are facial components? These cranial nerves are either sensory or the motor nerves, while some are the mixed cranial nerves. So the functional components are generally divided into motor efferent components and the sensory or the afferent components. The subdivisions of these components are that the motor efferents are divided into the general somatic efferent component, special visceral efferent, and general visceral efferent, while the sensory components, which are responsible for receiving the sensory information, they are subdivided into general somatic afferent, special somatic afferent, general visceral afferent, and special visceral afferent. So the basic understanding involves that the motor efferent component of the cranial nerves is responsible for the supply of muscles and giving the preganglionic parasympathetic fibers. Among these, the general somatic efferent component is that component which supplies the skeletal muscles or the striated muscles, somatic in origin. On the other hand, there are some striated muscles which are derived from the pharyngeal arches, and they are supplied by those cranial nerves who have the special visceral efferent type of the facial functional component. Lastly, the general visceral efferent component describes the preganglionic parasympathetic outflow of the cranial nerves, which relay in different ganglia like the ciliary ganglion, otic ganglion, pterygopalatine ganglion, and the submandibular ganglion. And in this way, they form the basis of the cranial parasympathetic outflow. All the cranial nerves with the parasympathetic function will have the general visceral efferent type of the functional component. Cranial nerves with the sensory function will have the sensory afferent functional component, while the general somatic afferent is concerned with the general sensation. Special somatic afferent is concerned with vision, balance, and hearing. General visceral afferent component receives the afferent from the viscera, and the special visceral afferent is concerned with the smell and taste functions. Now that we know the basic understanding of the functional component, we can apply our knowledge. So the first olfactory nerve, which is concerned with the sense of smell, has the special visceral afferent functional component. The optic nerve, which is concerned with the vision, will have special somatic afferent component. So the function will be vision. The third oculomotor nerve, concerned with the supply of the eyeball, motor supply of the eyeball, has two components. One is the general somatic efferent component, which supplies all the muscles of the eyeball except for the superior oblique and the lateral rectus muscle. In this way, it plays a role in the movement of the eyeball. The second component is the parasympathetic component, general visceral efferent component, which sends preganglionic fibers to the ciliary ganglion and which supply the sphincter pupillae and ciliary muscles, causing the pupillary constriction and accommodation. Fourth, trochlear nerve is a pure motor nerve with the general somatic efferent component only, as it supplies the superior oblique muscle. This muscle is responsible for the lateral and downward movement of the eyeball, depending on the axis of movement. The fifth, trigeminal nerve, is a mixed nerve. It has a sensory and a motor component. The motor component is the special visceral efferent and the sensory is the general somatic afferent. The special visceral efferent component supplies the muscles of the mastication, and since they are derived from the pharyngeal arches, so this motor component is the special visceral efferent type. The general somatic afferent component receives the sensations of pain, touch, temperature, proprioception from all over the face. Sixth abducent nerve is a pure motor nerve with the general somatic efferent component supplying only the lateral rectus muscle. The muscle is somatic in origin, and the main function of this muscle is the lateral deviation of the eyeball. Let's move on to the very important facial nerve. As we know that the facial nerve is responsible for the motor supply of our face and is involved in the facial expressions. But the muscles of the face, they are derived from the pharyngeal arches. So the special visceral efferent component of the facial nerve is justified as it supplies the facial muscles involved in our facial expression. The second component is the motor component is the general visceral efferent component, by which facial nerve sends preganglionic fibers to the different ganglia, ultimately supplying the submandibular, sublingual gland and the glands of mouth and face after relaying in the submandibular ganglion and the pterygopalatine ganglion. Thirdly, we have the special visceral afferent component, which is the sensory component of the facial nerve. This is special visceral afferent as it carries the taste fibers or the taste sensation from the anterior two-thirds of the tongue. So we have three functional components justified with the facial nerve, and facial nerve will be a mixed nerve. The eighth cranial nerve is the vestibulocochlear nerve. As we know, this nerve is concerned with the hearing and balance. So it has only one component, which is the special somatic afferent component. And it is easy to remember because of its function of hearing and balance. There comes the interesting combo of glossopharyngeal and the vagus nerve. They both have similar number of functional components, 3 afferents and 2 efferents. However, they differ in the areas of distribution. In case of the glossopharyngeal nerve, the special visceral efferent component supplies the stylopharyngeus muscle, which is involved in swallowing. The general visceral efferent component sends preganglionic parasympathetic fibers to the aortic ganglion, which ultimately supplies the parotid gland. And the 3 afferents, they receive general sensation and taste from the posterior one-third of the tongue, from the area of pharynx. Carotid bodies and carotid sinus, they also get their supply from the glossopharyngeal nerve. So this is the distribution of glossopharyngeal nerve, where there's 5 functional components. In case of the vagus nerve, we have similar number of functional components, special visceral and general visceral efferent, and 3 afferent components, general somatic, general visceral, and special visceral. However, the area of distribution in case of vagus nerve is different, and just to simplify it, the area which is involved in the vagus nerve distribution involves larynx, trachea, bronchi, lungs, heart, major thoracic blood vessels, area of GIT starting from the pharynx all the way to the splenic flexure of the colon, liver, kidneys, and pancreas. The last 2 cranial nerves, they are actually the motor nerves. However, they differ in the muscles they supply and their origin. For example, in case of the accessory nerve, the muscles which are supplied include sternocleidomastoid and trapezius, which are derived from the pharyngeal arches. So the functional component will be special visceral efferent. But in case of the hypoglossal nerve, the tongue muscles are somatic in origin, and the functional component would be general somatic efferent. Now that we have learned the functional components of each cranial nerve, let's do a quick activity where we'll try to group the nuclei of the nerves. As general somatic efferent group includes motor nucleus of 3rd, 4th, 6th, and 12th cranial nerve. Special visceral efferent will include motor nucleus of 5th and 7th nerve, nucleus ambiguous of 9th, 10th, and 11th cranial nerve. General visceral efferent will include Edinger vestibular nucleus of 3rd cranial nerve, superior and inferior salivatory nucleus of 7th and 9th cranial nerve, and dorsal vagus nucleus of 10th cranial nerve. Among the sensory functional components, general somatic afferent nuclei include 3 nucleus of trigeminal nerve, which are spinal, main sensory, and mesencephalic nucleus. Special somatic afferent includes 8th cranial nerve nuclei, which are cochlear and vestibular. General visceral and special visceral afferent will include nucleus of the solitary tract, as well as the gustatory nucleus concerned with the 7th, 9th, and 10th cranial nerves.